Suddenly, it feels like everything around you is spinning. The ground seems to move, and your heart starts beating very fast. You may feel as if you are about to fall, even though you are still standing. Friends, this condition is called vertigo or dizziness. It is not always just a physical problem. Sometimes it starts from the ear, sometimes from the mind and thoughts, and sometimes directly from anxiety. Many people think vertigo simply means low blood pressure. However, that type of feeling is usually called dizziness. Some people believe it happens because of weakness, while others become scared and start thinking they may have a serious illness because they are experiencing repeated episodes of dizziness. Today, I will explain what vertigo actually is, why it happens, and which kinds of dizziness are related to the body and which are connected to mental health, anxiety, and depression. Vertigo can begin from the ear, the brain, or anxiety itself. But remember, panic and anxiety can also trigger or worsen vertigo. Before moving ahead, please like, subscribe, and share our channel, and leave your questions in the comments. Remember, vertigo is not just ordinary dizziness. Dizziness can happen because of low blood pressure, but vertigo is a false sensation of movement. It feels as if the room is spinning or you yourself are spinning. This happens because of confusion between the brain and the ear's balance system, and that confusion can trigger a panic response in the body. Now the question is, why does the body's balance system become confused? One major reason is a condition called benign paroxysmal positional vertigo, BPPV. In this condition, tiny calcium crystals inside the ear move out of place. As soon as a person changes the position of their head, such as getting up from bed, turning to one side, or moving the head, sudden dizziness begins. In addition, infections, inflammation, or swelling inside the inner ear can also disturb balance signals and cause vertigo. You may also be surprised to know that people who suffer from migraines can experience dizziness even without having a headache. Similarly, severe dehydration or low blood levels can reduce oxygen supply to the brain, which may also lead to dizziness. However, if all your medical reports are normal, there is no ear problem, no blood-related issue, and you still experience dizziness, then there may be a connection between vertigo and mental health. Sometimes dizziness starts from the ear, and sometimes from anxiety, but fear keeps it alive. The first episode of vertigo may happen for any reason, but afterward the brain becomes alert and enters survival mode. The brain feels that something is wrong, which repeatedly activates anxiety. Breathing becomes faster, the heartbeat increases, the body becomes tense, and the fight or flight response gets activated. This tension confuses the body's balance system even more, causing dizziness to happen again. Gradually, the body learns a pattern. Even a small amount of fear or anxiety can make the brain think, now dizziness will happen. That is why many people have completely normal reports, yet their symptoms are very real. It is not imagination, it is an overload of the nervous system. Another important question is, how do doctors decide whether the problem is in the ear, the brain, or mental health? Remember, not every case of vertigo requires an MRI or brain scan. A skilled doctor can often make a diagnosis just by understanding the patient's history and symptoms. Doctors look at whether dizziness increases with movement, becomes worse when closing the eyes, or is linked with anxiety. Unnecessary tests can sometimes increase both anxiety and dizziness. Once the cause becomes clear, treatment becomes much easier. If the dizziness is caused by an ear problem such as BPPV or an inner ear infection, certain specific exercises can be very effective. Some medicines are also used for short-term relief, such as Circ, Stugerin Forte, Stematol. These medicines can help control dizziness for a short time. However, if vertigo is related to anxiety or depression, then the real treatment includes therapy, relaxation techniques, proper sleep, and treatment for mental health issues. It has also been observed that people who suddenly stop taking antidepressant medicines may experience dizziness as well. That is why finding the root cause of dizziness is extremely important. If anxiety or depression is the cause, then proper treatment is necessary. Friends, I hope this information was helpful for you.